Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Jill Toporski. Thank you so much for being here. How are you, Jill?
Great. Thank you, Colette.
We are so excited that you're here. Okay, today we are talking all about the Covenant Emergency Care Center. Now, as director, are there any trends that you've been seeing the last few weeks, Jill?
The trends that we've seen the last few weeks are what we typically see in our fall and winter season. So we're continuing to see illnesses and injury in addition to what we would call our cold and flu season.
Now, Jill, are there some things that people really should know about if they're seeking emergency care? What should they be aware of?
The biggest thing that I want the community to know is it is safe to seek emergency care. What we typically see around the holiday season is patients are busy with the hustle and bustle of the holidays and spending time with their family and friends that they often don't take care of themselves. Yeah. And we need to get a reminder out to them that it is safe to come into the emergency care center, and do not delay any treatment when it comes to your emergency needs.
I love it. Don't hesitate. Don't procrastinate. Go seek care. Now, Jill, if people have an urgent medical need, what should they do? What's the first step?
First, if it's an urgent medical need, we have the 5 urgent care locations throughout the community. If it's something that they think that they can follow up with their primary care physician or their family doctor, go ahead and give them a call. But if they're unable to do that, again, we do have those 5 urgent care locations. And if it's an emergent need, the emergency department is open 24 hours a day, 7 days a week. We also have a Covenant Care Connect, which you could reach them through our website or at 583-3135. And that has nurses 7 days a week that are specially trained to help connect patients and navigate them through the system if they're uncertain of where they should go.
Yeah, I love it. There are a lot of options and choices available out there, so don't hesitate and get care. Jill, what are some of those? Yeah, what are some of those major signs and symptoms that you say never ignore for people?
Never ignore chest pain,
okay.
Sudden shortness of breath, severe pain, head pain, severe injury, difficulty speaking, any weakness on one side, some difficulty with speech. Those are things you should never delay treatment with. Call 911 or come directly to an ER.
Yeah, and you know, Jill, before the pandemic, there was so much education about helping people learn the signs and symptoms of heart attacks and strokes. So can you remind us about some of those signs and symptoms of heart attacks and strokes that we should look out for?
Absolutely. Yeah. So again, that's that severe chest pain, unexplained jaw pain, weakness on one side or the other. Again, the severe head pain, shortness of breath. Those are all signs of a potential medical emergency, and intervention is key in being able to preserve the brain and the heart.
Yeah, with those major signs and symptoms, is it first like 911, you call 911 and go to emergency care? Is that the procedure for that? What would you suggest?
Absolutely.
Okay.
911, absolutely. If you are experiencing a medical emergency, 911 is your first way to go. And again, the emergency department is open 24 hours a day, 7 days a week.
Okay, that's great to keep reiterating. And why is time so important when it comes to heart attack or stroke?
When it comes to time for intervention, whether it is something with a procedure or the medication, to be able to reverse the damage that is happening to the brain or heart, it's absolutely crucial for those patients. We want everybody to be back to what their baseline is for function, and delaying treatment to those truly can help decrease the ability to do so.
Jill, anything else that you'd like to add? Anything that you'd like us to keep in mind, especially during the holiday season right now? What message do you have?
To take care of yourself and time with your family and friends, but please don't forget to take care of yourself and seek that medical treatment when necessary. Yeah,
we want everyone to stay around for their loved ones. Thank you so much for coming in with this valuable information. We appreciate you, Jill. Happy holidays to you. Merry Christmas.
You as well. Thank you.
Thank you so much. And if you'd like any more information about today's topic, just head on over to the Hot Links page. That's at WNEM.com.